Welcome to Core Competency Domain 3, Interprofessional Communication. The purpose of interprofessional education is to help students learn how to work as part of an effective interprofessional collaborative healthcare team. In 2011, the Interprofessional Education Collaborative, also known as IPEC, released 4 interrelated core competency domains for interprofessional education. These interprofessional education competencies were developed to better prepare health profession students to deliberately work together to meet the common goal of delivering high-quality, safe, patient-centered healthcare. This video will be addressing the third competency domain, which is to communicate with patients, families, communities, and other health professions in a responsive and responsible manner that supports a team approach to the maintenance of health and the treatment of disease. At the end of this training video, you'll be asked to answer a short series of questions about this interprofessional collaborative practice competency. These questions will help you monitor your mastery of the competency presented. The scenario centers around Ella, a 78-year-old woman who, in collaboration with her healthcare team, had decided to stop further cancer treatments and transition solely to palliative medicine and symptom management and control. Ella has been working with her interprofessional collaborative team for 2 years. Her daughter Karen lives out of town and is not supportive of the decision. Her daughter is visiting her mother for the purposes of reversing her mother's decision and resuming chemotherapy. Let's meet the team members. In addition to Ella, our patient, and her daughter Karen, there is Dr. Young, the oncologist who specialized in breast cancer, Jose, the oncology clinical nurse specialist and advanced practice nurse who works with cancer patients to manage symptoms, Andrea, the oncology social worker with advanced training in palliative care and psychosocial oncology, and Dr. Lee, the oncology pharmacist with experience in palliative care. If you want to know more about the roles on this team, watch videos 1 and 2 in this series. We're going to listen in on the family conference and then examine how some of the sub-competencies related to the interprofessional education communication competency apply.
Thank you everyone for coming today. We are here to talk together as a team about Ella's decision to end her chemotherapy treatments and focus solely on supportive and palliative care at this time. I know Karen has expressed some concern about her mother's decision. Ella, would you like to tell us more about your decision?
Sure. Basically, I've chosen to stop any further treatment for my cancer. I've thought long and hard about this, and I feel that it is the right thing for me to do. I'm tired of treatment, and I want to focus on enjoying the rest of the time that I have left.
I understand your decision, Ella. I just want to remind you, though, that there are some newly novel experimental treatments, including mTOR inhibitors, for your specific disease that show promise and that you would be a candidate for. I know we've discussed this already, but are you sure you don't want to give one of these treatments a try?
mTOR? What's that? What does that mean for my mom? Does it mean we only have experimental treatments left?
It is an experimental treatment that could impact her cancer, but it may not, which is why it is experimental. It could also make her feel worse, and that is why it's ultimately your choice, Ella.
Dr. Young, could you tell us what mTOR is? I'm not sure we are all familiar with that drug.
Of course, I'm sorry. mTOR is shorthand for a type or class of drug that can be used for cancer. Am I right, Dr. Lee? Is there anything you'd like to add?
Yes, that's correct. mTOR is a type of drug used when treating cancer, but what we don't know is how it will impact your mother's type of cancer.
I'm sorry for the confusion, Karen. Does that help?
Yes, but it sounds like you're all talking about giving up. Mom, why have you stopped fighting this so aggressively? I don't want you to go. We need to do everything possible right now.
Karen, I don't want to take it. The side effects are horrible. It's not how I want to spend the rest of my time. Dr. Lee, can you explain to Karen about the side effects?
While it may slow the rate of your mother's cancer, it won't cure it. And it can cause severe side effects such as loss of appetite, fatigue, diarrhea, or pneumonia.
Karen, I think it's important that you know that I'm not giving up. I'm simply coming to terms with the situation. It's easy for you to say, let's try something new. There's a new experimental drug. Let's keep going. Let's do everything possible. But the cancer is an experience I hope you never have to go through. I love you so much. And you know I love you. And a part of me will always be with you. But these treatments, I know this team that I have here, they're going to take care of me. They're going to abide by my wishes. And so to answer your question, Dr. Young, I am sure about this decision. Thank you for the reminder of the experimental drugs. I've thought long and hard, and I'm very comfortable with my decision.
Ella and I have also had several conversations with Jose the past few weeks about palliative care, which focuses on symptom management and quality of life. We've also talked about experimental treatments such as mTOR, and we have all reviewed the pros and cons of these treatments as a team that includes your mother.
Ella, we are here to support you in any way that we can, and we'll come up with a care plan together that makes the most sense to you. By having your whole team working together, we'll be able to come up with a treatment plan that fits you.
I have a great YouTube video that can help you understand what to expect from palliative care. I've shared it with your mother and she's found it very helpful. If you'd like, I could share it with you later, Karen.
I would like to see it when we're done here.
Of course.
I can see that you have a really supportive team around you, and you're going to receive good care, even if it won't cure you. But I can also see how my mom made this decision after speaking with her healthcare team and weighing all the options. It's hard for me.
I know.
I don't like it. I feel sad and helpless. But I'm very glad that you have such an involved team around.
We'll work on a care plan as a team and we'll reevaluate it regularly. We are here to continue to support you, Ella. Please do not hesitate to let us know how we are doing and if we need to do anything different. We will want to make sure the plan of care is up to date in the electronic health record so that there's no confusion, even if none of us is available. And we will have to schedule routine CBCs regularly to monitor for immunosuppression.
CBCs? Immunosuppression? That sounds serious. Is something going on that you haven't told me yet?
No, I'm sorry. I didn't mean to slip into medical jargon.
A CBC is a routine blood test that we do to check on your mother's ability to protect herself from infection. You see, the medication that we gave her to destroy the cancer cells also has a side effect of destroying white blood cells, which our bodies make to protect us from germs. It's a very common problem that people who've had Ella's treatment have.
Is there anything else that needs to be discussed in today's meeting that hasn't been covered?
No, I'm good.
Me too.
I think we are just about done here. Ella, Karen, are there any other topics you would like to discuss at this time?
No, I think that's it. I thank you all. I feel so at ease knowing that you're my team and that you will respect and listen to my wishes. And for right now, that's the best thing that we can have. I thank you.
A quick debriefing at the end of team meetings is one way to give instructive feedback to others about their performance on the team. One of the sub-competencies for interprofessional communication. It can also improve teamwork, which is the last interprofessional collaborative practice competency. The use of a debrief illustrates the sub-competency CC5. Give timely, sensitive, instructive feedback to others about their performance on the team, responding respectfully as a team member to feedback from others.
So, what were your thoughts on how our meeting went? What could we have done differently?
Overall, I felt the family meeting went well. Nice job, everyone.
I forgot about the patient with my mention of the drug class. I sometimes assume that patients know this. Jose, can you not apologize after me? I felt bad already.
You're right. I'm sorry. I'm not sure why I apologized as well.
I thought maybe I had missed a meeting where the mTOR class was discussed previously.
Understandable. I brought up the question to articulate what I thought Karen was wondering about. I'm glad she spoke up so we could make sure she wasn't confused or worrying about that too. I'll follow up with Karen about some of the feelings she brought up.
Yeah, I'm glad she spoke up too. Sometimes I forget that everyone doesn't think in the acronyms that we use daily. I can't believe I used the term CBC and immunosuppression right after we just finished clarifying what mTOR was. I really need to be better about avoiding medical jargon when patients and families are around.
You know, it's an easy mistake to make, but I'm sure if Karen hadn't spoken up, someone on the team would have caught it and clarified what was said.
Yeah, I hope so. I mean, just another example of it takes a village.
Agreed. I'm really glad we have a team in place for patients like Ella. It used to be a lot harder to get all of the patient's needs met when you thought you were the only one in charge of their care.
Yeah. Thanks, Jose, for encouraging this debriefing.
Yeah.
You know, there are always things that we can do better as a team.
This is Interprofessional Competency 3. Communicate with patients, families, communities, and other health professions in a responsive and responsible manner that supports a team approach to the maintenance of health and the treatment of disease. Let's examine what we saw illustrated in the family team meeting scenario that applies to the interprofessional communication competency along with its subcompetencies. In our family team meeting, the communication was with the patient, her family, and the healthcare team members, all from different professions. When we look at the specific interprofessional communication subcompetency, subcompetency 1, choose effective communication tools and techniques, including information systems and communication technologies, to facilitate discussions and interactions that enhance team function. Examples from our scenario about effective communication tools would include using a YouTube video for patient education and updating the electronic health record. Both of these are communication tools that use technology to enhance communication with the patient and the healthcare team. Team STEPS, which stands for Team Strategies and Tools to Enhance Performance and Patient Safety, is a national evidence-based teamwork system to improve communication and teamwork skills among healthcare professionals. One of the communication tools used from Team STEPS that we saw illustrated in the scenario was a technique called a check-back, which used closed-loop communication to ensure that information conveyed by the sender was understood by the receiver as intended. Essentially, an individual repeats the sender's message and confirms the message was correctly received. In our scenario, the check-back was illustrated by Dr. Young asking the pharmacist, Dr. Lee, to confirm his definition of the drug mTOR. Dr. Lee repeats the message, confirming that it was correct. The website for Team STEPS will be available at the end of this video. Subcompetency Interprofessional Communication 2. Organize and communicate information with patients, families, and healthcare team members in a form that is understandable, avoiding discipline-specific terminology when possible. Our scenario highlighted two opposite examples where medical jargon was inadvertently used, a common occurrence. Those examples included using the terms mTOR, CBC, and immunosuppression. The subcompetency is just more than terminology, though. It tasks us with finding ways to make information understandable, which could take a variety of forms, including using pictures, diagrams, videos, stories, and analogies. We also need to be sensitive to reading and health literacy. In true family-centered care, families are engaged in the conversation, not just provided with information. Even though healthcare team members often share a common vocabulary of medical terminology, team members may use discipline-specific terms, not even understanding that the terms are not universally understood. This competency will require that team members clarify unfamiliar terms with each other in order to promote common understanding. Different disciplines often have different terms for the same thing. Several of the subcompetencies addressed important communication skills. Subcompetency 3. Express one's knowledge and opinions to team members involved in patient care with confidence, clarity, and respect, working to ensure common understanding of information and treatment and care decisions. Subcompetency 4. Listen actively and encourage ideas and opinions of other team members. Subcompetency 6. Use respectful language appropriate for a given difficult situation, crucial conversation, or interprofessional conflict. This scenario qualifies as a difficult situation, and the dialogue illustrates the use of respectful language, active listening, encouraging opinions of others, and expressing one's opinions. Some of the examples from the scenario that illustrate subcompetency 4, listen actively, and encourage ideas and opinions of other team members were Andrea's active listening resulting in her responding to Karen in her question about mTOR by asking another team member's opinion. Dr. Young asking the pharmacist, Dr. Lee, to share his drug expertise on mTOR. And at the end of the meeting, Dr. Young asks other team members if anything else needs to be discussed, thus encouraging others' opinions. Respectful language was also used in discussing the conflict in which Jose had apologized for Dr. Young after she had already apologized. Dr. Young was comfortable in expressing that she felt it was not helpful and gave that feedback to Jose, who agreed. Subcompetency 7. Recognize how one's own uniqueness, including experience level, expertise, culture, power, and hierarchy within the healthcare team contributes to effective communication, conflict resolution, and positive interprofessional working relationships. This subcompetency is best met through self-reflection, thoughtful consideration of how these variables impact one's professional communication. Jose's reflecting on his use of an unnecessary apology would be one example of self-reflection. Lastly, subcompetency 8. Communicate consistently the importance of teamwork in patient-centered and community-focused care. A good example from the scenario that communicated the importance of teamwork in patient-centered care was Dr. Lee's comment that the whole team, working with the patient and her family, will be able to address the patient's needs and personalize the care to fit the patient. Also during the debrief, Dr. Young shared how she values the healthcare team in contributing to quality patient-centered care. A debrief checklist is available for use from the Team Steps website and includes questions the team can address during a debriefing. The IPE competencies can be accessed at the website on your screen. For further information about Team Steps, that can be found at the website also on your screen.